Majority of Americans want biometrics for health record access and sharing, Pew survey finds. Peep the slang. Biometrics are the first choice of patient health record identified by 54% of American adults, according to a survey. Charitable trust, and they want the federal government to take action to make it easier for them to share their electronic data. A majority of more than 1,200 people surveyed by Pew want to be able to share electronic health records, and 61% would like to be able to download their own health data. There is a significant split among racial lines, as 58% of white Americans choose biometric as their identifier of choice, compared to 50% of Hispanics and 41% of black respondents. The modality the highest number are comfortable with is fingerprint biometrics, with 32% say they are very comfortable with the technology, and additional 33% reporting they are somewhat comfortable with it. More than 50% are at least somewhat comfortable with eye scans and facial recognition, though only 21% and 18% are very comfortable with those biometric modalities respectively. More than a quarter, 27%, say they would be very comfortable with a unique number or code, while 39% would be somewhat comfortable with that kind of credential, giving it the highest overall comfort score. Healthcare providers using a smartphone app to match individuals to patient records would be fine with 22% and somewhat fine with another 31%. You hear that, man? Enabling different healthcare systems caring for the smart patient to share information between their her systems is supported by 81% of Americans. Roughly 3/4 want the federal government to set national standards for patients matching, and 2/3, including majorities of both Democrats and Republicans, want the government to invest in patient matching. Congress explicitly barred the Department of Health and Human Services for funding a national patient ID system more than 20 years ago, but a bipartisan effort was recently launched to reverse the federal government position. Patients wants to have access to their information through an app, Pew found. Though, when informed that data download to an app might falls outside of health insurance portability, and Accountability Act privacy protections, 9 out of 10 expressed some concern. Pew say it will conduct more research on biometrics to understand how they work in other fields and what lessons could be learned for using them to support data exchange, maintain privacy, and promote equity in healthcare, writes Ben Moskovich, project director for health information technology at Pew. Understand the slang.